Just going to do a little video about heel pain. Had quite a few people coming into the clinic recently complaining of this, so just going to do a wee video just to clear a few things up and explain a few things. So heel pain, what is it? Heel pain is certainly by far one of the more common conditions we have coming into work. If you go to a doctor or GP complaining of heel pain, the chances are they will diagnose you with plantar fasciitis. That might be a term that you're already familiar with, and you maybe even diagnose yourself with plantar fasciitis. So it's quite a controversial area, but we tend not to call it that too much anymore. As you probably know, if you put itis on the end of something, it tends to mean that there's inflammation involved. If you think about the lungs, bronchitis, inflammation of the bronchi in the lungs. Depending on the literature that you read, this doesn't involve inflammation, or we don't think that the inflammation side of things is of primary concern. There are other things that we want to focus on. So, as I say, inflammation side is a bit controversial. There is quite a big debate about it at the moment. But as I say, there are other things that we want to focus on. So inflammation not involved so much. What is involved? So we have the plantar fascia, which is certainly involved. The plantar fascia is a very broad fan-shaped ligament that starts around about here on the toes, and it fans down into this very narrow insertion just in the heel bone, in the calcaneum, round about here. It's a very important structure, it's a very strong structure, and it's important when it comes to walking and running. It is a ligament that basically maintains the integrity of the arch, so it holds the arch up. If I just flex the big toe here, just dorsiflex it a wee bit, I've got a good example here because the plantar fascia actually just pops out a wee bit. You can see it running just along there. Plantar fascia, when running or walking, the big toe will dorsiflex like this, the plantar fascia will tighten, and it makes the foot a very rigid structure, so it allows you to kind of push forward and propel forward. So it's very important when it comes to walking and running, so you can understand why it's always susceptible to quite a lot of strain and injury. If you have plantar heel pain, what you might be experiencing is pain around about the insertion of the plantar fascia. So if you're struggling with this, if you're palpating in that area there, that might be quite sore. This will be the condition that you're dealing with. Another absolute key characteristic is this will hurt a lot first thing in the morning. If you get out of bed and take that first step in the morning and this is really sore around about this area here, then this is absolutely the condition that you're dealing with. So what is going on around here in the heel? Inflammation not so much involved. What we think now is that there are compression issues around about here in this fatty pad. Everyone has a fatty pad in their heel, and we think that there's a problem here with the way that this fatty pad attenuates the shock when you make ground contact when you're walking. There's a lot of structures going on underneath the fatty pad in the heel here, one of them being the insertion of the plantar fascia. So we're thinking now that there are compression issues and the way that the fatty pad here absorbs the shock. I think there's a change in the structure. So that's kind of the route that we're wanting to go down when it comes to treatment. There are a lot of things we can do for this. It's a very painful condition, but if there's anything good about it, there are a lot of things we can do. Some of the simple at-home things that you can do are ice. You can try icing it. Like I said, not for the inflammation side of things, but more for the anaesthetic qualities that ice has. And you can try stretching as well, just doing exercise at home, just simply pulling your big toe up like that as well. Hold it for a couple of seconds, about 30 seconds, and then try pushing it a wee bit further and hold it for 30 seconds again. Simple exercises you can do at home that might just help. But ultimately, you want to try and get in touch with a podiatrist to stop this from going from an acute injury, so around about 4 weeks, becoming a chronic injury around about 6 months. Absolutely key that you get on top of it as quickly as you can. So if you think you are struggling with plantar heel pain, give us a call at Easter Road Podiatry and we can help you out.